The start of covering every Indian with COVID-19 vaccines got a big boost today because children between the age of 15 and 18 are now also eligible for vaccinations, and that drive has begun today. In various states, we saw children lining up between 15 to 18, and it will probably go a long way in covering us very well. But a few questions have also cropped up. Now, anecdotal stories coming in that some parents, some kids are hesitant to get the vaccination. There was a clarification earlier today from the Health Ministry that reports saying expired vaccines are being given to children are incorrect. Remember, in the last week of December, the CDS CEO extended the shelf life of Covaxin from 9 months to 12 months. And between 15 to 18 years age, kids are eligible only for Covaxin and not Covishield. So to speak on a few important things, I have a great panel lined up today. First, we're going to clear up any confusion, doubts and fears about vaccines for children between 15 to 18. We're also going to understand the extent of threat from Omicron, because the numbers are jumping up very, very quickly, and that seems scary. But hospitalization rates are not. So should that allow us to, heave a bit of a sigh of relief? In light of that, are the kind of restrictions that we're seeing actually necessary? So to speak on this, I'm joined now by Dr. N.K Arora. He is the chair of the COVID subcommittee of NTAGI. Dr. Chandrakant Lahariya is joining us on the show today. He's an epidemiologist. And Viren Shetty, Executive Director and Group COO, Narayana Health, is also joining us. Welcome to all of you, and thank you so much for speaking with us in the new year on the India Development Debate, where we've had a rocky start to the new year with Omicron, but hopefully things will get better. Dr. Arora, let me come to you with the first key question that people are wondering about today. Is the vaccine that 15 to 18-year-olds are being given safe for them, good for them? And what about the question of an extended shelf life, where some of these vaccines, which would have otherwise expired, are now being relabeled and given to children?
So, thank you very much, Tamanna, for inviting me. I would like to assure you and the panel and our viewers that the vaccine which is being given is completely potent and safe vaccine. See, initially when the vaccines were given regulatory permissions, the period was very short. So they were given a shelf life of 6 to 9 months. But over the time, scientific studies have been done, and now it has been found that vaccine is potent and safe for 12 months. And that is what this extension of the shelf life has been provided. And this is not the only example. See, one of the most commonly talked about vaccines are Pfizer vaccine and Moderna vaccines. Both these vaccines have been given an extension of shelf life for 3 months, from 6 months to 9 months. So it is a usual thing, because in the way and the manner in which COVID vaccines were rolled out, the time available for manufacturers was less. So similarly, in our country, the same thing has happened. Laboratory testing and scientific studies have been done, and it is only after that the shelf life is now made 12 months. So again, I will assure the vaccines are absolutely potent and safe, and there should not be any confusion about it.
Nevertheless, Dr. Arora, let me get a follow-up question from you right now. A lot of parents, and I have spoken to a lot of parents today, you hear that as well, are in a wait and watch mode, because it's about the children. And what they are thinking is that let more kids take the vaccine, let more numbers grow of those who have taken the vaccine in that age group, and then we will go ahead. What would you say to assure them? And has there been enough transparency in the way this extension has been given?
So the extension has been given after proper regulatory processes have been given. The applications were made, and then only the extension has been given. And I must assure again that laboratory testing about potency and animal experiments have also been done. So there should not be any doubt about that. Second, I think parents thinking that let us wait, let others get it, and then we'll do it. I think it is not a great idea. The reason is that Omicron is spreading in an exponential manner. And it is this time that we must protect our young friends, 15 to 18 years. So as soon and with the first opportunity, we should give all our 15 to 17-year-old adolescents the vaccine so that they benefit from it. And I must tell you, because many of our children are already having natural infection, even the first dose itself will start providing protection against severe disease and need for hospitalization. So we must immediately, all parents must immediately go without any delay and get the child vaccine.
Dr. Chandrakant Lahariya, I want you to weigh in on these two important points that I've raised with Dr. Arora as well. One is the safety of children taking vaccines who have had their shelf life extended, and you know, your message or your advice to parents, I'm sure a lot have been asking you as well, that should we give our kids the vaccine or should we wait and watch? Is the threat of unvaccinated children between 15 to 18 from Omicron greater, or is it greater from the vaccine if people have doubts?
So thanks, Tamanna. So there is no reason to be worried about the vaccine. What we need to remember that Covaxin is based upon a platform which is known for ages and decades or centuries. It's an inactivated vaccine which are very safe. That's one. Second part is that vaccine has undergone a rigorous process. It has received approval within India, but it has received also WHO emergency use listing. Third and most importantly, Covaxin has already been administered to around 15 crores of adults. So there is every reason to believe that vaccine is safe, effective, and it works. So there is no reason to worry for the parents. That's one. Second part is that I have been hearing from different sectors that today only 1% of the target population registered on portal. But we need to remember that this is going to be a process. And I am confident that parents would come forward to receive vaccine. Third part, and what we need to remember is that I would really urge to those parents, like every child who is eligible should receive vaccine, but I would specifically urge to those parents whose child has a pre-existing comorbidity, such as like either they are on long-term treatment or any other health condition or asthma or any condition which require long-term management. So those children should, the parents of such children should prioritize the vaccination of those children before anyone else. They don't have to wait for this thing, but every child should receive vaccine. Finally, Dr. Arora said that there is no reason to be worried about that shelf life has been extended. This is a standard process. Once vaccine was given emergency use authorization, shelf life was shorter and then it has been extended, but that is not a concern. Usually vaccines have a shelf life of 18 months to 2 years, but since these vaccines have not have that much of time, so they have been extended to this period. It is very much possible that in future the shelf life could be even longer. So my request to parents is that please go ahead, get your child vaccinated on priority basis. This will protect them from the severe disease, hospitalization and death.
Yeah. Viren, what is the kind of preparation as far as private hospitals are concerned to give out the vaccination to those between 15 to 18? Are you seeing a lot of enthusiasm or some hesitation in taking the vaccine?
We've not seen any. See, the fact is when you've come to a hospital, people have already made up their mind that they're going to get their children vaccinated. So in that, we've got an adequate response from people that have shown up to get the Covaxin done for children aged 15 to 18. In the preparation, we had adequate stock of Covaxin to last us for this week, and the government has assured us that they have adequate stocks to cover us as and when the pickup happens. So I would say it's a decent enough start. It's not overwhelming, but it's not too little either. It's good enough, and momentum will build. The thing about everyone feels like they have a choice when they think there is time. But as a virus surges like this, then you start to realize that you're doing a cost-benefit analysis all the time. You could wait, but the fact is 15 to 18-year age group, these are children who have to write board exams, and they have to write that physically. And it is always better to get them vaccinated before you do a board exam than not. And these are tried and trusted platforms. Now, of course, there will be better drugs tomorrow. Of course, because every generation you keep improving on the drugs. But this is what is there right now.
Yeah. The other key question that we want to raise in this discussion today, because we're starting off this period with an overhang of Omicron and a lot of confusion about what it means. So, Dr. Arora, let me come to you about the narrative around Omicron. Cases are rising very quickly. State governments, local administrations are responding with increasing the number of restrictions, but at the same time, hospitalization seems to be low. Would you say that we don't need to fear Omicron as much as previous variants?
So, you're absolutely right that there is a kind of a galloping increase in the numbers of COVID cases. And during last 3 or 4 days, we have seen the number have gone up nationally by 3 times, from 13,000 to around 35,000 today. So the numbers are increasing, and 100% genomic surveillance is being done in selected cities. And we find in Delhi, as it was announced some time back, that over 80% of the new COVID patients are Omicron by genomic surveillance in last week. So this clearly shows the Omicron proportion is increasing. The third thing is that when we view the global data, and particularly data from South Africa, which shows the cases increase rapidly, but the hospitalization comes down remarkably. I mean, it's much less as compared to Delta. And within India, we have reviewed the data, and it shows that all those who are admitted with Omicron are again those who have comorbidities. So therefore, vaccination, primary vaccination is important, because it does reduce the possibility of anybody getting serious disease. But if somebody has comorbidities, and if the person is also partially or unimmunized, then the risk of hospitalization will increase. Overall, when we see the data from Mumbai shows today's data, that despite the massive increase of numbers in last 24 hours, only 95% beds are still available, and there is nobody on a ventilator or requiring that kind of care. So overall, I would say serious disease is likely to be less, but if the numbers increase massively, if we are not careful, then the pressure on health system will build in. And therefore, it is important that corona-appropriate behavior is absolutely must. Mask is our most potent and time-tested weapon against COVID disease. The second is, when we say social distancing, the most important thing is to keep away from crowd, because it is highly infectious. We don't know the next person if he's harboring the vaccine. And the other, the point of concern is that most of the infections are asymptomatic. So the person may be asymptomatic, but it can pass on the infection to the next person, and particularly if the person is having comorbidities, then risk of severe disease increases. So keeping everything in mind, not to panic, but keep our guards on and be careful.
So, Dr. Lahariya, what do you make of the kind of restrictions that are being announced? So, for example, schools have been moved back to virtual classes in a lot of places. In Mumbai, the announcement was made today. It's happened in different parts of the country, really. Do you think that that is something that is required right now? The other kind of restrictions that have come in, some states have started putting in restrictions on, salons, spas, restaurants, things like that. The fact that this is, say, now the second year, the third year, really, that we are living with COVID-19, and this is a variant that has come about, but our approach to it, the remedy seems to be exactly the same, to put down restrictions. Do you think that that's what we need to do right now as well? And do you think we should have evolved a different approach by now?
There is no doubt that we should have evolved. In the last 2 years, there is a lot of scientific and epidemiological understanding of the virus, and most importantly, currently in the infection and disease, both of these should be seen separately. There is a clear decoupling. And when I say what it means that if there were 100 cases or infection or confirmed cases a year ago in Delta wave, 20 of them would require hospitalization, majority of them would require oxygen, and some will go to ICU. But in Omicron wave, for every 100 cases, there could be only 2 who would require hospitalization, none may require oxygen beds. So this is a clearly evolved situation. What we also know from scientifically and epidemiologically, that the number of cases are low, but individuals who have a previous infection or at least one vaccine, so hybrid immunity provide protection from future disease. So these are all of the things which are really much improved. Final and most important in this scientific understanding is that when the lockdown or restrictions were put in March, April 2020, the idea was to strengthen health system, prepare hospital beds, and be ready for what are the learning and understanding. 18 months or 20 months since then, the hospital beds and other infrastructure ready. So definitely our approach has to be more nuanced, calibrated, and proportionate to the challenge. As an example, in Delhi or Mumbai, the cases are rising, so some restrictions are allowed. But if we go by the graded response action plan of Delhi, by today, the test positivity rate has crossed 5% plus. And by that standard, Delhi should be under lockdown, but that is not the right graded response action plan. So I think we need to factor in, and we need to change in our parameters on which the response will be mounted. The response cannot be mounted in January 2022 solely based upon number of new cases. It is to be designed based upon what is the hospitalization rate, what proportion of patients require oxygen, and all other factors. So it requires key thinking. And another important point is, which I want to flag, is that globally we have understood far better. UNICEF and UNESCO had said that school should be the last to close and first to open. There is no point in closing school at 0.5% of test positivity rate. So there are many things other states are doing which are not correct. Last point here is that economic activity, we need to create a balance. The disease as of now is mild. If there is evidence that it is serious, then we need to further strengthen the regulation or restriction. But we use current understanding and knowledge to mount the response. Each of the states need to design their approach. We cannot simply say that just because United States or Denmark or Netherlands or UK has some restriction, we should simply blindly follow. India's situation is very different. And in epidemiology, in India, context matters a lot, and that's what should design or result in a restriction, which India is not doing. Indian states are not doing enough, but I hope they will do in the coming days and weeks.
Dr. Arora, I just want your response to the point Dr. Lahariya has made on restrictions, especially with kids going to school. We would now have some children who have not seen the inside of a schoolroom for a second academic year, for over 2 years. Do you think that there is enough evidence now to show that it's safer to keep younger children at home?
So, I would in fact completely concur with Dr. Lahariya. And the children require cognitive development, intellectual development, and physical development. And this does not come only with parental interaction, but peer group interaction. So it's absolutely important that school activities should continue. And at this time, when we have started vaccination for 15 to 18, so this is an additional protective covering which is being provided to adolescents. But school children need to continue. And as it was said before also, and it has been said right for last 6-8 months, that primary school children are least affected as far as symptomatic infection is concerned or severe disease is concerned. Infection occurs across the age group. It's almost like adults, but it is the symptomatic disease or severe disease which is important. Therefore, schools must continue. I will add on to what Chandrakant has said, that smart containment strategy, India has done extremely well in that, and which can be done at district and sub-district level. So the whole Delhi does not need to be closed. There is South Delhi district and West Delhi, and within district, there are small regions or mohallas or lanes. So economic activities should not be stopped, but smart containment activities are required. And as very rightly said, it has to be context specific. And the guidelines have been I think, disseminated across the countries to all the districts, that the decisions have to be taken at district and sub-district level, so that life goes on. But we should see that the spread of the infection is in a way that is calibrated, managed, and the pressure on the health system, that will be an important guiding pointer or indicator how to manage the containment activities at district level.
You know, the pressure on the health system is the big question mark. Viren, we are speaking today on the 3rd of Jan, where cases have grown exponentially. Omicron is doubling the number of cases at the rate of, I think, 3 to 4 days. But hospitals are not filling up yet. Our hospitals, our private hospitals, are you prepared for a situation where the cases started to rise to the extent that the number of people in hospitals also increases a lot?
Just to stress on one point, the number of people testing COVID positive is a leading indicator. Hospitalization is a lagging indicator. So one of the last things that will happen in this surge is that hospitals get full, because there is a gap from the time you get infected and then it progresses and then it causes whatever the Omicron is supposed to cause in comorbid people. So as of right now, our COVID wards are quite empty. We only have 5-10 patients in Bangalore and maybe 10-20 in Delhi. It's not a lot. We have made all the preparations because we anticipated if something like this were to happen, similar to what happened in the Delta surge, that the entire hospital can be converted at a moment's notice. We've invested a lot in all the infrastructure, and not just us. Hospitals around the country have bought oxygenators, they've bought ventilators, they've trained people in ICU care. And fortunately, it is still a relatively simple disease to treat, in that the drugs that you used to treat them haven't changed from the last round. Maybe there are better drugs available, but they belong to the same class of drugs. So the doctors are as prepared as they're going to be. And we will wait and see. As long as we exhibit COVID-appropriate behavior, wear your mask, don't attend mass gatherings where a large number of unmasked people are, it shouldn't surge to the same extent. And to the extent that it does surge, because this is a very fast-spreading virus, most of the healthcare systems across the country in the large cities will be able to take care. And one can only hope. At this point, there really isn't much you can do, because it is at the community level. The Omicron is out there. We're doing the best that we can. The hospitals are prepared. The rest is just up to us to see how we deal with it and factor this as part of our normal lives.
Yep. Factor this as part of our normal life, at least for the months of January and perhaps February. We have to brace ourselves for the large numbers that are very likely to come in. We still have to see the surge caused by New Year celebrations in various parts of the country where there were some amount of gatherings. But let's keep our fingers crossed and hope that the numbers dissipate as fast as they have increased, like we have seen in some provinces of South Africa and other countries. Meanwhile, I want to thank all of you for joining us today on what is a very important day to understand exactly what we're dealing with.